Hello everyone, my name is Dhanya. I'm a physical therapist. So today I'm going to discuss about the shoulder complex. Shoulder complex is a phenomenal joint in our body because it involves three bones and then more than three joints also. Moreover, it helps to attach our upper extremity to the thorax. So first let's see the components of shoulder complex. So there are three bony components. The first one is clavicle and second one is humerus and then we have the scapula. Now let's see what are the joints involved in the shoulder complex. We have a sternoclavicular joint, acromioclavicular joint, glenohumeral joint and scapula-thoracic joint. So first let's see about the sternoclavicular joint. So what are the articulating surface included in the sternoclavicular joint? It has the medial end of clavicle. There is a medial end of clavicle and then there is a notch formed from the manubrium of sternum and the first costal cartilage. So this is the articulating surface of sternoclavicular joint. So the clavicle is here and then manubrium and the first costal cartilage. So these are the articulating surface of sternoclavicular joint. So we learned that the sternoclavicular joint is not congruent. So how the congruency of joint is improved, how it is not getting slipped or not dislocated. Here comes the role of sternoclavicular joint disc. So sternoclavicular joint disc plays a major role to improve the congruency and to absorb a lot of pressure which is coming to the joint from the lateral side. So let's see where is this disc attached. So disc has to attach between the clavicle, manubrium and the first costal cartilage, right? So let's see the attachment of disc. So it is attached on the postero-superior aspect. That means posterior superior aspect of clavicle and then it goes down and attached to the manubrium of sternum and then to the first costal cartilage. Okay, so that is that's the attachment of disc. So what is the function of this disc? So first we have already learned that the disc helps to improve the congruency of joint and the second important function, it absorbs the lateral directed force. That means if we are abducting the arm or if any lateral directed force is coming from the shoulder, so the disc helps to absorb those force and hence the joint is getting protected. Let's see about the ligaments of sternoclavicular joint. So we have three major ligaments. The first ligament is anterior and posterior sternoclavicular ligaments and second one is costoclavicular ligaments and the third one is interclavicular ligaments. So anterior and posterior sternoclavicular ligaments prevent excessive anterior and posterior movement of the clavicle. That's a simple thing. Second one is costoclavicular ligament. So let's see about what is costoclavicular ligaments. That means from the first rib, there are two ligaments which is coming and up at, which comes and attached to the clavicle from down below. That means it's attached like a V shape from the down. So the first function of costoclavicular joint is to prevent the excessive elevation. It will allow the clavicle to move up, but after a certain limit, it will become taut and prevent the excessive elevation of clavicle. And it also helps for the inferior gliding. The second function, it helps for the inferior gliding of the clavicle. So the third function, we know the sternocleidomastoid muscle and sternohyoid muscle is attached to the clavicle. So sternocleidomastoid muscle or sternohyoid muscle can cause an elevated force on the clavicle, which is prevented by the costoclavicular ligaments. The third ligament is interclavicular ligament, and the interclavicular ligament prevents the excessive depression of lateral end of clavicle. So this excessive depression, when it prevents the excessive depression, it helps to protect the brachial plexus, which goes just behind the clavicle. So these are the three major ligaments. First is anterior posterior sternoclavicular ligaments, costoclavicular ligaments, and the third is interclavicular ligaments. Now let's see about the sternoclavicular joint motions. There are three major motions involved in the sternoclavicular joint. The first one is protraction and retraction, elevation and depression, and then posterior rotation and then back to the anterior rotation. So protraction and retraction. That means when we say protraction and retraction, we can refer the lateral end of clavicle. It moves anteriorly, then it is known as protracted. When the lateral end of clavicle move posteriorly, it is known as retraction. So in this protraction and retraction, the clavicle is concave and the manubrium is convex. during elevation and depression. The clavicle, the middle end of clavicle is convex, and then the manubrium is concave. So that means during elevation and depression, the lateral end of clavicle is moving upward, elevation, and depression means the lateral end of clavicle is coming downward. The third movement is known as posterior rotation and then the anterior rotation. That means the clavicle can rotate only to the posterior side, and once the clavicle is rotated to the posterior side, it comes back to the anterior rotation. That means only one rotation is actually presented in the clavicle, the posterior rotation, and then back to the anterior rotation. So the closed pack position of sternoclavicular joint is maximum elevation and then protraction, and then open pack position is the arm by side. So that's the closed and open pack position of sternoclavicular joint. And what are the nerves which supply the sternoclavicular joint? The first nerve is supraclavicular nerve, and then nerve to subclavius, and the third one is T1 nerve root.